to have you on Roland Martin Unfiltered. So can you explain to us this, whatever's being described, where you get a hit on the chest, all of a sudden that can lead to cardiac arrest?
And you may have heard and you may have seen on social media, maybe on any other newscast, that they're talking about commotio cordis, which is a Latin term that literally means agitation of the heart. But what that actually means when we translate it is that there was a malignant arrhythmia, meaning that his heart went into an abnormal rhythm. And that abnormal rhythm is called ventricular fibrillation, no matter what causes it. Once you develop that abnormal rhythm, your heart is no longer beating in conjunction, in a coordinated fashion. And so you're not able to pump blood, which is carrying oxygen. And within a few seconds, 5 or 6 seconds, you can completely lose consciousness, which I think we saw there within 6 seconds of that hit, standing. So therefore, it appears that it was not a spinal injury. He was able to stand up completely erect and then collapsed with the loss of blood flow to the brain and other organs.
And if you're hit on is it on the left side? And so is that what it is? Because if you look at the play, he makes the tackle and he comes down on his left side.
You know, it is extremely rare, but you are exactly right. You're hit on the left chamber of the heart, the anterior chamber of your heart, in your left chest, but also at a very specific angle and also at a very specific time in the electrical coordination cycle of the heart. So all of those things have to come together. In other words, your electrical cycle was interrupted. You have a distortion of the heart muscle right at a very specific time in the heart called repolarization, an electrical signal in the heart. And so all of those things have to come together, which is why it is rare, but it certainly occurs. And we generally do not see it in football. We see it in sports that require projectile type objects like hockey pucks,
right.
Things that can very rapid rate, they're very hard and can completely have a big impact on the chest, or baseball.
In fact, I'm glad you brought that up because Chris Pronger was a hockey player. We have the video here. This happened in 1998. It was during a game. Y'all have the video there, folks. You should play there. During a game, puck hits him, very similar. And the exact same thing happened. You see him collapse there. 12 weeks later, he was back on the ice and went on to a Hall of Fame hockey career. Mm-hmm. So even though this happened, based upon if he's able to recover, come back fully, it doesn't mean that his career is over.
And so here are a number of things. You know, when we talk about cardiology and a lot of traumatic injuries, we look at things in a stepwise fashion.
Right.
So this is not sort of one big statement that we would need to make. So the first thing when someone has sudden death, which is actually what happened, this is cardiac arrest is sudden death, is that you must receive CPR or defibrillation fairly quickly. It appears that he began to receive CPR. Generally, when you get defibrillated after sudden death, if you can be defibrillated within the first minute, you approach almost a 100% chance of recovery. If you can be defibrillated within the first 2 minutes, you can approach almost an 80% recovery. I could not see on the field when exactly he was defibrillated. I understand a defibrillator came to the field. I have watched every video I could find, but I could not see because of the people surrounding him. But after that defibrillation, the next step is he reached the hospital with a pulse, as I understand it. So he made that next step. Then he was intubated and sedated, and maybe even his body cooled to recover. And so the next step now will be to see if there's any return of neurologic function. And that necessarily doesn't happen overnight, so we shouldn't be concerned if he suddenly doesn't develop a full return to neurologic capacity within a day or so. It may take a few days, but that's where we are, and we measure it really in steps and progress and support the patient along the way.
Well, and the key is that he is still alive.
And the key is that he received emergency resuscitation immediately. Without that, he most certainly would die. It is very important for people to learn bystander CPR such that you can intervene. You really can make a difference between whether somebody survives or doesn't survive, or whether they survive in different types of neurologic deficits, or whether they're able to come back completely.
Dr. Jane Morgan, we certainly appreciate you joining us, giving us that full breakdown. Thanks a lot. All right, folks, back to our Roland Unfiltered video.